Hey everyone, Dr. Eric here from Med Better Health. Now, one of the common questions I get asked all the time is, Dr. Eric, how do I deal with behavioral issues in my person living with dementia, right? So we're going to go through a couple today. Are you ready? Let's go. So let's take a look over here. First of all, let's define what are delusions and what is a hallucination. Two different things, right? So delusions are false beliefs that the person accepts as an absolute truth. What are some of the delusions that a person living with dementia can have? Very, very common. Stolen item. You stole my earrings. You stole my clothing. Very, very often in people and persons living with dementia. Number two, oh, my husband, he's having an affair, right? That's a delusion. That's a false belief. And then there's a persecution. You're trying to hurt me. You're trying to kill me. That is what a delusion is. Okay, well, what is a hallucination then? A hallucination is actually a false sensory experience that involves sight, sound, or touch. So think about this. Someone is hearing things. Oh, I'm hearing the kids in the yard, but there are no kids. Someone is seeing things, but there's no one actually there, but they see them, right? So where a delusion is a false belief, a 90-year-old saying, where is my mother? She's alive. No, she is alive. Why are you telling me she passed away? Whereas a hallucination is where someone is seeing, oh, there's my mom. Hi, Mom, how are you? Very, very common in late stage dementia. So let's go through something important. There's always a trigger, an antecedent, always something that is triggering this behavior. But before we go into that, when you have this hallucination or delusion, the patient has an altered reality. And then what happens? Because the reality is altered, they have an emotional response. It's either fear, confusion, anxiety. And then because of that emotional response, they have this behavioral fallout. It goes from reality to reaction. And it could either be anger, agitation, aggression, verbal abuse, hoarding. Now, one thing for you to remember, if you're a caregiver and you're watching this, these are not bad behaviors. It's not that Charlie is behaving very badly. No, these are actually reactions that they're having to frightening or confusion sense of reality. Remember, when grandma is saying she's seeing her mom, her world with her glasses, she's actually seeing her mom. Or when she says, I'm seeing a monster, in her reality, she actually sees the monster. So it's not that, oh my God, she's behaving badly, what is she doing? That is her reality. And for you, the caregiver, that's important to realize. Now, for the caregivers listening, it's not easy. Think about it. Every day, right, as the dementia progresses, you are the ones who have to deal with the aggression, with the anger, with the verbal abuse, with the hoarding in your home, and you feel like you're alone. Now, in the end of this video, I'm going to talk about a new program, a dementia program, which is completely covered by Medicare, which our organization, Med Better Health, can help you. And I'll talk about it in the following few lessons. But let's continue to take a look. Now, this is a very important slide. I mean, if you're going to look at a slide, we've defined the delusions. We've defined the hallucinations. Now, like, all right, but what is triggering? What's the antecedent? What comes before? What's causing my loved one to see something? Now, one of the things before you start or anyone else starts to say, oh, it's just the dementia getting worse. You got to always be careful. If this is something new and grandma never had delusions or hallucinations before, the first thing you got to rule out is what? Infections. So important. So many people miss this, right? Don't just say, oh, it's probably the dementia. No. Take a look and say, you know what? It may be a UTI. It may be another type of infection, right? But UTIs are very, very common. Is your loved one taking something like Lasix, furosemide, which is a diuretic? Diuretics take all the elements out. It could, I'm not telling you to stop to take it, right? Ask your doctor always. This is not medical advice, this is education. But diuretics can cause something called hyponatremia, where your sodium levels go down. And when the sodium levels go down, what happens here? Hallucinations, delusions. So before you start saying it's just dementia, rule out things that are reversible. UTI, dehydration, malnutrition, unaddressed pain, medications. Was there a new medication that was added and all of a sudden mom started to have delusions or hallucinations? Super, super important. Lack of oxygen. And then this we talk about all the time, sensory loss. When your person living with dementia, when they can't hear well, when they can't see well, the information in their mind is misinterpreted. And they see, for example, a shadow, and it's not really a shadow. To them at night, the shadow from the coat rack looks like a ghost. So they misinterpret it because they can't see. Now, the program that I talked to you a little earlier about, our role in that program, one of many, is to educate you, just like I'm doing like this, is to educate you about all these different things that you're going to come across as a caregiver taking care of your person living with dementia. So, moving on, very important list, right? Very important list that I want you to remember. Now, what happens over here? A chaotic or unfamiliar environment creates sensory overload. Let's take a look. This is the home, right? So, for example, there's a change in routine. Your person living with dementia used to always stay in that bedroom. Now you're having renovations and you're taking them and you're moving them to another room, right? That can cause hallucinations or delusions. Mostly hallucinations very often in folks. Poor lighting that creates shadows. Stimulation, sensory overload. We talk about this in the next slide, but imagine this. You have a room, your loved one is living with you, your person living with dementia, you have kids, and your kids are listening to Tupac and Biggie, right? And the music, that's the generation I come from. I'm sure some kids listening like, who's Tupac, who's Biggie, right? But they're listening to loud music. And the person living with dementia, they get this overstimulation. Or make pretend you have that person living with dementia, it's your mom, you turn on the TV, you're not looking really what she's watching, and there's a horror movie there, right? And she's looking at that horror movie, and there's people killing each other. That overstimulation, when they'll give her hallucinations, will give her delusions. When there's no specific routine, right, it's all over the place, then they start being confused because everything is strange for them. It's overstimulation of their mind. So, what do we do? This is so important. Number one, I said rule out reversible causes like infection or electrolyte abnormalities. That's the first thing that you do. But when you ruled all that out and now you say, yeah, it actually is dementia-related delusions or hallucinations, what do? Rule number one, acknowledge. Okay, I understand. It's not that they're acting poorly. I understand that their sense of reality is very different than mine. Number two, I'm never going to argue with them. I'm not going to argue. I'm going to use something called validation therapy. Oh, you see a ghost over there, Mom? Huh, let me take a look. Wow, hold on, Mom, let me get it. I got it, Mom. And don't you ever come back again here. You understand? Never come back. Okay, Mom, the ghost is no longer there. Everything's okay. Come, why don't we sit down and... Then what I'm going to do? Why don't we sit down and I'm going to redirect. What does redirecting mean? Once I've addressed the emotions, I'm going to steer the attention to a positive activity. I'm going to say, Mom, why don't you take a look at this album? These are my kids. Look, oh, remember when we went swimming? Look how beautiful that looks. I'm going to redirect. Why? Why am I not going to argue with the hallucination, with the delusion? Because remember, their experience is real to them. It's a real experience to them. Now, the logic trap. A lot of people say, well, I'm going to prove that there is no ghost there. Do not do that. Saying, oh, it isn't there. Don't do that. The connection strategy. Remain calm. Never argue. be supportive, de-escalate and comfort, right? Because their reality has been altered by dementia. So try not to take the accusations personally. Now, a lot of the times you're going to take it personally. My mom, she's been living with my grandma, and really she's the daughter-in-law, like a real daughter, for the past 20 years. And once she came into the room and my grandma told her, "Where is my mother?" And my mom told her, "Oh, like your mom is dead." Like, she tried to use what? She tried to use logic. My grandma looks at her and says, "You're the worst daughter-in-law I've ever had. I regret that my son married you. You've always been out to get me." Now, my grandma didn't mean that, right? We all know that. But my mom, she, unless as part of the program that we teach you through this new Medicare covered program called the Guide Model, which Med Better Health participates in, has been selected by Medicare, I taught my mom, "Mom, don't take it personally, right? Because grandma's reality has been altered, and don't take these accusations personally. What you got to do, Mom, is you got to validate, yes, your mom is here. She went shopping." And then you got to do what? You got to redirect. You got to redirect. So I hope this video was very, very helpful for you. These are very, very important points. And if you are a caregiver and you are exhausted and you're looking for support, you're looking for resources, you're looking where you can call somebody 24/7. Think about it. Something happens like this at night, and you can pick up the phone and you can call someone at 10 p.m. and say, "I don't know if this is an infection. I don't know if this is just a delusion. Can you help me?" And you get that. That is what our program does. It's called the Guide Model. And imagine if you had a rough night with mom and you just need the next day to take a little bit of a break, and you need someone to cover and sit with mom while you're taking a break. The Guide Model actually provides someone to go to your home, if you qualify, and be there with your mom. So if you're interested in this program and you found this information helpful, there's a lot more like this as part of our program. Click on the QR code that you see over here or scan it. Now, if you've got a phone and you're looking at it, obviously you can't scan it. So we're actually going to have a link that you can click right over here. Follow that link and you'll learn more about the model. You could put in your information and you can apply, and then you can be approved for this new program, which doesn't cost anything and is completely covered by Medicare. Again, this is Dr. Eric from Med Better Health, and I'll see you in the next episode.